Hello everyone, welcome to this session. Today we are going to discuss the radius, a long bone in the forearm. It is lateral to the ulna, located laterally in the forearm, and it has three main parts. It has the upper end or proximal end, the lower end or distal end, and the shaft. The upper end has the head, the neck, and the radial tuberosity. The head of the radius is disc-like, and in living individuals, it is covered by an articular hyaline cartilage. The head of the radius articulates with the capitulum superiorly to form the humeroradial articulation. The circumference of the radial head articulates with the radial notch of the ulna medially, and the rest of the circumference of the radial head is covered by the annular ligament. The neck of the radius is located between the head of the radius and the radial tuberosity. The neck is constricted and it provides an attachment for the quadrate ligament on its medial surface. The radial tuberosity is located in the medial aspect of the radius, and it is a site for insertion of the biceps tendon. It has two parts. It has the smooth anterior part and a rough posterior part. The smooth anterior part is covered by a small synovial bursa, and this bursa separates the biceps tendon from the radius. The rough part is a site for insertion of the biceps tendon. The lower end of the radius is the widest part of the bone. It has 5 surfaces. It has an anterior surface, the medial surface, the lateral surface, inferior surface, and the posterior surface. The anterior surface has a thick ridge for attachment of the palmo-radiocarpal ligament. The medial surface has a depression here, the ulnar notch for articulation with the head of the ulna. The articular disc of the inferior radioulnar joint is attached to this lower margin of the ulnar notch. The lateral surface has a projection here, the styloid process, and the styloid process is related to the tendons of adductor pollicis longus and extensor pollicis brevis. Brachioradialis muscle inserts at the base of the styloid process. The radial collateral ligament attaches at the tip of the styloid process. The inferior surface is also known as the distal surface, and it has a triangular area in the lateral aspect and a quadrangular area in the medial aspect. The triangular area, which is on the lateral aspect, articulates with the scaphoid, and the quadrangular area, which is medial, articulates with the lunate. The posterior surface has a groove here called the tubercle of Lister, which is an important landmark for locating the anatomical snuff box. The shaft of the radius has 3 borders. It has an anterior border, the medial border or interosseous border, and a posterior border. This one here. The radius has 3 surfaces: an anterior surface between the anterior border and the medial border or interosseous border, the posterior surface, which is between the interosseous border or medial border and the posterior border. The lateral surface, which is between the anterior border and the posterior border. The anterior surface of the radius is concave, and it is a site for origin of flexor pollicis longus. The flexor pollicis longus originates from its upper 2/4. It is also a site for origin of pronator quadratus in its lower 1/4. The posterior surface between the medial border and the posterior border. The posterior surface of the radius is a site of origin of adductor pollicis longus, which originates in the middle 1/3 of the shaft of the radius. The posterior surface is also the site of origin of extensor pollicis brevis, which originates from its lower 1/3. The lateral surface, which is between the anterior border and the posterior border. The lateral surface is a site for insertion of supinator muscle, which inserts on the upper 1/3 of the radius. Pronator teres inserts on the rough area in the most convex middle part of the lateral surface. Anatomical position and side determination of the radius. To determine the side of the radius should be kept in a vertical position in such a way that the head of the radius, which is disc shaped, is directed upwards. The widened part and the styloid process are directed downwards, and the styloid process is lateral. The sharp border or the interosseous border is directed medially. The convexity of the shaft should be directed laterally, and that will help us know the side of the radius. For this case, this is the left radius.